Hi, my name is Jen Carnine, and today I will be presenting a speech on attention deficit hyperactivity disorder, also called ADHD. Attention deficit hyperactivity disorder, or ADHD, is one of the most common childhood disorders and can continue through adolescence and adulthood. ADHD is the most commonly diagnosed childhood behavioral disorder in children. Many people believe ADHD is not a legitimate disorder, that it is the parents' fault for being lazy or not disciplining their children. It seems to me that people tend to pass judgment without really getting to know the facts. I work in a school setting, and it is disturbing to me how many negative comments I hear from teachers about the children who do suffer from ADHD. ADHD is recognized as a disorder or disability by the Centers for Disease Control, the National Institute of Health, the United States Congress, the Department of Education, the Office for Civil Rights, the American Medical Association, and every other major professional medical, psychiatric, and psychological and educational association that there is. ADHD is often misdiagnosed by doctors. There are many symptoms that could be confused with other disabilities among children. Scientists are not sure what causes ADHD, although many studies suggest that genes play a large role in ADHD. Children mature at different rates and have different personalities, temperaments, and energy levels. ADHD symptoms usually appear early in life, often between the ages of 3 and 6, and because symptoms vary from person to person, the disorder can be hard to diagnose. Parents may first notice that their child loses interest in things sooner rather than compared to other children their age, or they might consistently seem out of control. There's no single test that can diagnose a child with ADHD. Instead, a licensed health professional needs to gather information about the child and his or her behavior and environment. Currently, available treatments focus on medication, improving functioning through behavior therapy, psychotherapy, various types of therapy for the child. Attention hyperactivity and impulsivity are the main behaviors of children with ADHD. Obviously, all children can be inattentive, hyperactive, or impulsive at times. But for children with ADHD, these behaviors are more severe and they occur more often. To be diagnosed with this disorder, a child must have symptoms for 6 or more months and to a degree that is greater than other children of the same age. Some children with ADHD may be easily distracted, forget things, frequently switch from one activity to another, have difficulty focusing on one thing, fidget or squirm in their seats, talk nonstop. They may be very impatient, have difficulty writing. They may have difficulty waiting for things that they want, waiting their turn. They often interrupt conversations when others are speaking. Obviously, the current medications do not cure ADHD. They control the symptoms as long as they are taken. Medications can help a child pay attention. They can help them complete schoolwork. Adding behavior therapy, counseling, and practical support can help a child with ADHD and their families to better cope with the everyday problems that come with ADHD. Children with ADHD need guidance and understanding from their parents and teachers to reach their full potential and to succeed in school. Parents are encouraged to share pleasant and relaxing activities with their child, to notice and point out when a child does good. Obviously, positive reinforcement helps any child. Praise the child's strengths and abilities. They may try to structure situations in more positive ways. For example, a child may need to restrict the number of playmates that they play with to 1 or 2 to prevent the child from becoming overstimulated. My daughter has been diagnosed with ADHD. She's excessively hyperactive. She has a very difficult time paying attention, and it's frustrating to me for people to pass judgment on that, possibly stating that maybe it is my parenting, or maybe she's overtired, or whatever excuse they might have. But the fact is that she does suffer from ADHD. I have tried several medications, both stimulant and non-stimulant medication, to help her, and I have not had any success with the medications. She does go to behavioral therapy, which is helping us tremendously. School is difficult for her, and so it's very frustrating to me to watch my child struggle. So I hope that you'll take the information that I have presented, and I encourage you to educate yourself before you pass judgment on children who suffer from this disability, or really any disability that may have misconceptions. Thank you for your time.